Morning, good afternoon, good evening. Welcome, everybody. So great to be here for the closing day of Mobilize. And thanks to Shreya and Kunal Kumar for a great introduction. It's really amazing to hear about everything that's happened in Pune, but also the influence that really has been made at the national level with the Smart Cities mission and now the new initiatives around the Cycle for Change and Streets for People. It's really amazing to hear the progress that's being made. Well, I am here to moderate a session that's really about the cross-section of transportation and the healthcare sector and health. There are so many connections between transportation and health, and as we were planning Mobilize, this was one of the first topics that we put on the agenda, and that was early in the year, long before the pandemic had even struck and healthcare was on the minds of everyone. At the time, we were really thinking about Pune and topics that would be relevant as we were walking the streets there, learning from their accomplishments as a Sustainable Transportation Award winner. The city has made so much progress with supporting more active and healthy forms of mobility with walking and cycling through the design of their complete streets. And they've rolled out incredible clean e-bus fleets on their streets as well. And that just shows in stark contrast to the often poor air quality that we see in cities throughout India and throughout the world, and the possibilities for real change and improvements. And these are just a couple of the intersections of health and transportation that we thought of as we brought this topic to you. There are so many reasons, and we wanted to spur more knowledge and more advocacy on the topic through this discussion. To just cover a few things from the top, the health benefits of walking and cycling have been the focus of attention in the transportation sector for many years. As people become more sedentary and spend more time in transportation, walking and cycling are often pointed to as healthier, active forms of transportation. But at the same time, we know that cars kill and are one of the leading causes of death, often killing people that are walking and cycling without safe infrastructure. Approximately 1.35 million people die each year, and car crashes are the leading cause of death for children between the ages of 5 and 29. Another major health concern is the damage created to our lungs from air pollution caused by cars. Air pollution kills almost 400,000 people per year. And as I'm sure many of you heard, a Harvard study released earlier this year showed that people exposed to bad air quality had a 15 times greater chance of dying from COVID. So real terrible consequences. And of course, because of COVID, we're beginning to see so many other connections between health, the health of our people and the health of our cities, especially as it relates to transportation systems and urban planning. Whether people have access to healthcare or other basic services is often limited by their ability to travel. So many topics to cover, and we are here today to dive in and get advice from our experienced experts on what we can do to improve mobility for the health of our people. I'm honored to be moderating this panel today with three highly credible and experienced experts. I want to quickly introduce you to them, and then we'll get into the discussion. First, we're very honored to have Madam Minister Dagmawit Moges here, the Minister of Transport in Addis Ababa, Ethiopia, where she was appointed as minister in October 2018. Before her current post, she served as Deputy Mayor of Communications Affairs Bureau Head, the cabinet member of city government, and a board chairperson of Addis Ababa Mass Media Agency Board. And she's involved in many boards currently, including the Ethiopia Postal Service Enterprise and Ethiopian Airlines. So a lot of positions and a high influential person, and we're very lucky to have you with us. Second, Professor Majid Azadi, Professor of Global Environmental Health at Imperial College in London, UK, where his group conducts studies on air pollution in Kenya, Ghana, the Gambia, and China. Professor Azadi has led research that has been the basis of numerous influential studies, including the groundbreaking 2002 World Health Report on reducing risks and promoting healthy life. He's currently, he leads a number of research efforts that underpin international initiatives, including one called the Pathways to Equitable Healthy Cities, which we'll hear more about today. And lastly, Dr. Maria Nera, the Director of the Department of Environment, Climate Change, and Health at the World Health Organization in Geneva, Switzerland. Thank you for being with us. Dr. Maria Nera is a Spanish physician and has been working for WHO since 1993, with her first assignment being coordinator of the Global Task Force on Cholera Control. I'm sure she must be thinking of a lot of similarities as we face COVID. Before Maria joined the WHO, she worked around the world as a public health advisor, including with the UNDP and the Médecins Sans Frontières throughout Africa and South America. Thank you so much for all of you for being with us. I'd like to start with the discussion on what it means to plan mobility with the objective of equitable public health. And Maria, I thought I would start with you sort of at the highest of levels as the agency of the United Nations responsible for international public health. The WHO is at the center of ensuring all peoples have the highest possible level of health. What has been your observation about how COVID has exposed the strengths and the weaknesses of the health of our cities?
Thank you very much, and it's really an honor and a pleasure and to have this debate about new ideas and how can we mobilize our community using this Mobilize approach. I think is fantastic, and of course we are living exceptional times. I think COVID-19 has been a kind of volcano for all of us and is shaking all of the public health bases, but I hope that at least in addition to learning that we need to have a very, very solid universal health coverage, we need to have very well-trained health professionals, we need to invest on the research capacity of those professionals, and we need to make sure that everybody will have access to the services we want. I think one of the key lessons is that we need to look upstream as well. What has been accelerating or creating the conditions for this type of pandemics or public health crisis to occur? And one of them is obviously our relationship with nature and the ecosystem, which is not exactly very good. We have been destroying nature, which is the source of our health for a long time, and creating the perfect conditions for the barriers between animal health and human health to be broken. But in addition to that, if you add the fact that our cities, our urban spaces are very dense, are very populated, and not necessarily creating the conditions for our citizens to be safe, to be healthy. I think one of the messages now for our population, which feels so threatened by what is happening now and their capacity to receive more negative information is very limited. We need to tell them that now we need to build the perfect barriers or the green walls to reduce their vulnerability in the future. And in that sense, WHO has identified what we call a manifesto, where we provide prescriptions for a healthy and green recovery. And one of those prescriptions, actually the number 5, is exactly about cities, about urban space, about the land planning, about how we are promoting a healthy urban planning. And that, on that aspect, obviously the commuting, the mobility will play an enormous place there. At the moment we are talking, many governments are dedicating or will be dedicating big amounts of stimulus packages and financial support to rebuild after COVID-19. So I think we need to influence that way that the investments will be done. And one of the ways to invest is making sure that the investments will be wise, will be cost effective, will be addressing those weaknesses that we have identified. And in addition to that, those investments we are promoting will be generating not only better protection for the health of the people and reducing vulnerability and minimizing risks, but there will be able as well to generate more jobs, better economy, better society recovery. So it's all a win-win if we are able to promote those investments in the right direction. Concretely at the urban level, at the city level, on the mobility, we more than ever, we need to keep promoting a sustainable transport, a healthy, sustainable transport for people. People want to commute, so we need to make sure that they have accessible means they can walk and make sure that our cities will reduce the density in our cities, and therefore we will reduce as well the risk for infectious agents to spread. We need to make our cities places where the mental health is protected as well, and there is some social engagement and social interaction between citizens. We need to build cities where we can practice some physical activity. At the moment in some cities is absolutely almost impossible. And of course, the horrible thing of air pollution. You mentioned 400,000 deaths every year caused by air pollution in Europe. If you put the global figure, which I think is important to mention, is we are talking about 7 million premature deaths caused every year by exposure to air pollution. And of course, citizens who are for a long time exposed to air pollution, they will have a very vulnerable lungs in case there is an emerging new virus, a respiratory one. There will be much more vulnerable. And once they get the COVID-19, the outcome will be probably more severe than a person that have not been exposed to air pollution. So investing on air quality and the role that the mobility and the transport can play is fundamental. So the health argument has to be at front. I'm sure the minister is perfectly aware of that, and all the academicians and everybody working on this, but please use more the health argument. This is the argument that will convince people whenever you need to take decisions at the country level or at the city level. If you tell the citizens how that investment you are doing on sustainable transport will benefit the reduction of air pollution, the facility to reduce the sedentary lifestyle and the injuries, I think that will be the winning argument and the one that will generate jobs as well. So allowing to recovery the economy that we all know that at the moment is very, very badly needed. So some reflections like that, happy to keep with the dialogue, but obviously health can be the driving force and the engine to do more on a good transport. We need to be very creative as well. Huh? People now is generating a kind of fear about public transport. We need to change that completely, and we need to make sure that we will not, because of the COVID, people will go back to use the private cars again. So mobility, providing mobility as well to the peri-urban areas, if the people decide to go to the peri-urban areas to have better life conditions, and this creativity in exceptional times on a very pragmatic and strategic way, I think is very, very much needed, but all positive. Over. Thank you.
Thank you, Dr. Nero. Thank you so much for your insights. I'm sure having thought about this for so many years, COVID just must be introducing so many challenges, but also so many opportunities. I think the point on air quality is one that we've certainly been following for so many years. And Professor Majid, I know that that's something that you've been focused on quite a lot in your work, looking at the pathways for public health and the relationships for air quality. Can you tell us a little bit more about your research and what you're finding as the pathways for better mobility and more equitable health care in urban places?
Sure. Thank you for having me at this great conference. So I'll start from actually the very last point that Maria mentioned, which is actually getting people around, and especially people from peri-urban areas, suburban areas. So I think in public health for a long time, we thought of transport as an agent of bad things, and so it makes the air full of pollution and injuries, and people are getting around in cars and they are not being active, and all of those nasty things that we sort of attributed to transportation. And I mean, I think there is actually fundamental epidemiological truth to all of that, but I think we forgot for a long time in public health that actually the main purpose of transportation is just to get people around. I mean, that is most fundamental purpose. So being able to move around means that people can have a job, which means that they can have an income, which means that they can actually have food. Being able to move around means that children can go to schools when the schools are far away. And being able to get around means that people actually can go and see their physicians when they need to. So in two cities that I know well, London and Accra, in both of them, where actually healthcare is free, there is, or a great deal of healthcare is free, there is universal health coverage. The poorest of the poor actually miss out on healthcare because they just can't get there. And if you go to a place like Dhaka, where there are 5 million people living in the slums, women die in childbearing, actually at home in a city, not because they are not entitled to go to a facility, but because they cannot get to a facility. There is no transportation. So I think, in some sense, just the idea of getting around is arguably the most important way to which transportation contributes to health. And I really, I think it has been talking to our transportation colleagues that has made us think about it in this more holistic way, which is, remembering that a lot of positives come from mobility. And the question is, how do we actually make sure that those who need it, when they need it, have those? And yet there aren't sort of a whole set of negative aspects that the Marianera brought up. And I think that gets to the issues of, it's very hard to separate that from the issue of where people live and where those services are, where schools are, where jobs are, where healthcare is. So I'll leave that for later. I know that may come up later in the session. So I'll leave the idea of where services are for the moment. But I think taking that where they are, then the question becomes that what is the transportation infrastructure, services, and pricing? I think cost is the other component of this that allows the poorest of the poor to get around. So, and I think that's really what we are doing a lot these days. That has changed in the COVID era. So again, taking the two cities that I know, in London, it's actually been quite easy for a lot of middle class and upper class to actually work remotely. Similar situations in Accra. What has actually happened is with restrictions on public transport, for very good reasons, those restrictions, to actually break transmission rates, it's made it harder for the poor to get around. So our colleagues in Accra are actually doing studies that is looking at the rules that are imposed, the very good rules for social distancing, and what it means for the ability of the poor to actually get on minibuses, and can they actually go to their work? Can they go to healthcare? And I think it's trying to take this question of access, which is fundamentally the role of transportation, to put it side by side with all of the more proximal ways through which transport affects health, so injuries and air and all of those, and seeing that what becomes the strategies that make it more equitable from the health perspective for everybody. I think the last thing I'll say is actually the role of time. So I think the other thing we should remember is that, unfortunately, we live in the world that one of the resources that's very limited for the poor is time. So somebody who is working 2 jobs to actually just make ends meet, and there are many in the countries, again, in every country, the idea that they get home or to work half hour later or sooner means time spent on cooking a healthy meal for their child. It's time spent on doing something else that they cannot do. So I think it's the issue of, again, access, timely access, low cost access, that minimizes the sort of externalities that were mentioned. And we are working on this in a number of countries. Accra and London are 2 of the key focuses of this, but other places also. So back to you, Heather.
Thank you, Professor. Such an interesting way of looking at it. It is so true. We often talk so much about the bad externalities and not necessarily the positive side, and what we really need to maximize with that. We think about mobility all the time, but really mobility as access to services is so important. Madam Minister, I want to turn to you. I know we're all very excited to hear about the great things that are happening in Addis Ababa. So many exciting steps are being taken to make it a safe place for walking and cycling. And I know much of this happened before the pandemic, but can you tell us more about what you are doing in Addis Ababa, why you decided to move in that direction, and whether COVID has impacted the decisions at all?
Thank you very much for the opportunity, and thank you very much for having me here. As you said rightly, and as it has been perfectly mentioned by both speakers before me, whenever we talk about equitable public health. We are also saying unequitable access and safe transportation system too. And as a transport minister and as a city resident, the pleasure of leading a decent lifestyle in our cities and towns relies on how far we bring the attention of using streets for people rather than for cars or vehicles. We choose roads for people, giving priority for humanity, evolving desire to live in a well-connected, healthy, and green cities. And one great lesson we have learned during COVID pandemic is having non-motorized transport is not only for addressing the demand of shortage of supply that we face in the transport service, rather it's even a tool for shaping the health of our people. Although the majority of Ethiopians use walking as a mode of transport, yet still motorized transport mode is favored over non-motorized transport system. If we are able to provide accessible and comfortable pedestrian ways and cycle lanes, we believe that the majority of Ethiopians could access equitable share of active mobility system. I'll come back to the point that has been just mentioned by Professor Majid. Because of lack of access, a woman who is about to give birth is losing her life. And that is a practical scenario that we see on daily activities that we carry out in our country. And our objective as a transport ministry is to ensure that access is going to be assured for the public. And in areas where we assure access, we are saying that we need to make sure that it's going to be comfortable and it must be accommodative of non-motorized transports too. Creating or making an access for vehicles by itself is not going to address the needs of all those poor people that we have in our country. We must be able to make sure that all the roads that we construct is going to inculcate those bike lanes and walking lanes for the pedestrians as well. So all our citizens, especially in urban Ethiopia, should not be disadvantaged from attending active transportation schemes. And we believe that people should not be disadvantaged because of their socio-economic status, age, gender, or religion, whatever the case might be. The lack of access to transport system may directly or indirectly affect the health status of our people. For instance, as I said earlier, in rural areas, access to roads has been a major challenge that cause maternal mortality, as mothers were not able to access public or health centers because of inaccessibility of those centers. We therefore practiced Warada transformation program, where different ministries, we come together and try to address the issue in an integrated manner. It is being coordinated by Ministry of Health, and our ministry has a role in that, and also Ministry of Water and Irrigation and Road Construction and other ministries. We come together in a form or in an entitlement called Warada transformation, or it's called district transformation. So we are going to work starting from the district by making each and every district that we have in the rural areas to be more accessible by integrating all the efforts in different ministries rather than trying to address the case independently. For instance, Ministry of Health is striving to construct education centers. Ministry of Education is striving to construct schools. Ministry of Health is striving to construct health centers. But unless and otherwise, these resources, social centers, are not accessible, it's not going to serve its ultimate purpose. So that's why we started to work more integratedly and plan together, execute together, and monitor its ultimate result in a more integrated manner. So this is a kind of intervention that we have started in our country. And currently, as our country, Ethiopia, is experiencing a rapid economic population growth, we are also witnessing rising levels of air and noise pollution in urban centers, and which directly or indirectly affects the health and the status of the health status of our citizen. Ethiopia's climate resilient transport strategy clearly addresses an affordable and integrated, safe, and responsive transport system to be in place. But to be able to make sure that it is going to be realized in practice, it's not something that we can bring within a short period of time. It needs continuous engagement of different stakeholders, continuous engagement and practice of the actions that we're going to take to make sure that we are changing the real situation on ground by taking different mitigational measures to reduce the emission from different modes of transport. It's not only trucks, but all modes of transport. They are causing air pollution. And this mitigation strategy should be in place to make sure that it's not going to harm the well-being of our citizens. To be able to address this aspect as a transport sector in different parts of the city, to take an example of Addis Ababa city, which is the capital of our country, currently we are in placing about 7 rapid bus lanes in order to reduce small vehicles utilization and to change it to mass transport. We are working on the construction of 7 bus rapid lanes, and at the same time, the city government is engaging itself in the purchase of about 3,000 buses to be able to address the demand and at the same time to reduce the number of small vehicles in the city. And in addition to that, by doing this, we are still encouraging people to enjoy their first and last mile transport through using active modes of transport, such as walking and cycling, which is not going to address the issue of transport, but also the one which is going to assure the health status of each and every citizen that we have. And as the majority of Ethiopian population is youth and children, preparing safe bikeways and walkways for this group of people is very critical. And whenever we talk about mobility as a source of equitable public transport or public health system, we should ask the question, do public really understands the health benefits of active mobility? Most of the time, people may start physical activities after they faced some health challenge, after they're recommended by their doctors to do so. But before things happen, before their health status gets under big question mark, the utilization of these active modes of transport by itself is going to protect the health of our people. And that's why we are introducing the new non-motorized transport, which we launched during the pandemic season. And we are working aggressively to make sure that it's going to be implemented in each and every cities and urban centers that we have in the country. And I can say that the start is, even at the starting season, it's showing us some kind of fruits, but we need to keep on pushing that it's going to be owned by all people and all stakeholders that we have. Thank you very much.
Thank you, Minister. It's so impressive to hear all of the things that are happening in Addis. It's great to hear that all roads will be built with cycling and walk lanes, sidewalks, and the investment in the BRT, 7 BRT corridors is really impressive, the focus on public transportation. I wanted to turn to a question that's maybe a little bit to do with land use and transportation. Throughout your comments, there's been a mention of density, mention of making transportation better, but also making sure that schools, healthcare is more accessible based on land use. And also what's been mentioned is kind of the changing of patterns in cities, the changing of density and people moving in and moving out of cities. So I wanted each of you to maybe comment on the role of density, especially as we think about COVID. It's been kind of used as a scapegoat in often cases to blame the pandemic, but we know that most of our cities are extremely dense and there's no getting around it. And also that our transportation systems are essentially based on filling the buses to get the revenue, which again creates crowding and is a concern during COVID. So can you say a little bit more about this issue of land use and density and how we deal with that as we move to the future? And Professor, maybe I'll start with you since I know that this has been the focus of a lot of your research recently.
Sure. So let me. I mean, I'm glad you brought up the question, and I'll mention something about density, but I'll come to land use perhaps more broadly. I mean, I won't say much about density and COVID because I actually think that how much this is about density, how much it's about everything else that goes with it, poor housing, poverty, and so on. We yet have to see that. So I think that one. I think there is still a lot of room for empirical research. But I think on the density issue, obviously, there is this tension between denser places are easier to get around or shorter distances. So if you want people to go a shorter distance, hence be able to walk or cycle, you make it denser. Yet there comes a point that density becomes an agent, at least for air pollution and noise pollution, if not for other aspects. And again, there is room for empiricism that in any kind of setting, what's the optimal density. But I think if we go in land use beyond density and we talk about where do we place things and how do we actually organize our city, so both a narrow version of urban form, but a sort of a broader version of it that includes in it placement of jobs and services. And this comes to, I guess, a comment that again, the minister made around the issue of all of the ministries being together in it rather than a transport. So in some sense, actually, strangely, a transport challenge is not just a transport challenge. It's if we think about it as transportation is, I mean, people don't get into cars just because they enjoy getting into cars. I mean, maybe some do, but I think most people don't get into cars just because they want to get into cars. They get into cars to go to a place. And if we bring the places that they want to go close to them, we make it actually a lot easier for them to go to. So I think one of the things that we should remember in promoting active transportation is that in our current cities, with their current organization, they tend to favor the rich and the young. So I think it may be a good thing, but we should remember that they are actually the increase in inequality. So maybe nobody is worse off, but those who are better off tend to be the middle class, the people who actually don't have to go 25 kilometers to make it to the first job, and then go another 20 kilometers to make it to the second job that they have, and they tend to be younger. So, whereas if we were to consider that the cities need to change together with it, and some of that will be perhaps some of it will be outside of the government's sort of abilities. It's driven by the private sector, although even there is incentives, economic incentives, zoning incentives that governments can bring in. But certainly those that are about schools were mentioned, healthcare was mentioned. Those are very much in the realm that governments can do. So if we have to actually, if good schools are so that children can walk to good schools rather than they are so far away that they actually have to get into a car, if good hospitals and good doctors are actually where people can walk to them or get there in a way, then it reduces the need to go there. And I think if we were to look at this from an equity perspective, again, equity that goes across demographics, but also across social groups, it's really hard to think about the transportation question, and especially healthy transportation question of the type that Marianera has mentioned, without actually bringing land use and placement of services and facilities into it. So I think that's a key part of it. And then the last thing I'll mention, but I'll wait in case we come back to it, is obviously the role of new technology. So again, we live in a world that I am going to my office in 10 days from now for the first time in 8 months, just for half a day. I could actually completely function away from my office. There was actually a piece in the newspaper today that Estonia has actually championed remote and technology-based education, largely because they had invested in it over the past decade or so. So Estonian children could just go away from their schools and for months be educated completely where, British children couldn't, or at least poor British children couldn't be educated well. So how do we actually use technology in a way, and similar things are coming up in the case of telemedicine. How do we actually use technology in a way that enhances equity in terms of services and reduces the need for people to go far distances rather than actually worsening it? So I think the land use and the technology questions, they just have to be central to resolving the mobility question in a way that's sustainable and healthy rather than considering them side issues.
Thank you, Professor. I know Kunal had brought up that point in his comments as well, that digitalization definitely has a lot of opportunities to bridge some of these divides. Dr. Maria Nera, do you have any comments on this conundrum of density versus sprawl and the health of our cities and people?
My comment will be that this is one clear area where this famous intersectoriality needs to play a role. We have been saying about this health in all policies. We have been talking about the need for having an intersectorial planning and different ministers engaging. And clearly now the way we will be doing the future healthy urban planning, because I love to add this healthy urban planning and land use, it has to be a strategic and coordinated one and intersectorial. I don't think we need to keep resolving the problems on a very ad hoc way, and then we have this sustainable transport is a very nice initiative, but it's ad hoc and maybe it's responding to one of the needs for access that has been described here as many times as a critical need. That's why people commute in the cities. They want to go from here to here. And if you can provide me something very nice and easy and cheap, much better, but you need to respond to my needs. And so instead of keeping on this ad hoc approach, this is where now we need to think on a healthy urban planning, where transport, mobility, commuting, responding to the needs of the people, plus the inequities that we are generating, this is fundamental. So we need to talk with the health providers and see what is the most convenient to allow people to get access to hospitals and healthcare facilities. We need to talk with the people responsible for education and see what is the needs for kids and the safer. We need to have an approach with the Ministry of Health as well, an important one. And probably we need to start to look at the new model of our urban development. With the COVID-19, we have the impression, of course, the Professor Majid will say that we still need a lot of research, and I fully agree with that. But the intuition tells us that maybe after COVID-19, some people might be attracted by rural areas. And so some people might leave the urban areas because of the density, because of the conditions, because of the teleworking, because now they can afford it. Maybe they can work outside Madrid and then commute if needed only once a week, and then they can have a bigger house and a garden, things that they cannot afford in the middle of London, for instance. So all of those things will play a role, but it has to be a role where we play a leading strategic thinking. Otherwise, things will be happening by coincidence or by chance or without any strategic planning. And I think we have plenty of science, we have plenty of health arguments, we have plenty of equity arguments in favor of having a very strategic and intersectorial discussion around transport, health, and urban planning. Over.
Thank you. Thank you. Madam Minister, maybe I'll turn to you. You clearly have been able to get your ministries to align like we've been talking about. Are you all thinking about the future of changing in densities as well? And what has really gotten all of your ministers to coordinate so well? Do you have some words of advice for us for others looking to do the same?
Thank you very much. Yes, we are coming together because when we pay a visit to our residents, the question that they raised was very touching. We identified their interests. And when we gather them and ask them what they want, said, you build a hospital for us, you build education centers for us, but how do you expect us to access that? How do you expect our youth to go there and benefit from the facilities that you have built to us? This was one of the questions that has been raised by one of our farmers in the rural, nearly suburban area. So immediately after that, we start to sit down together and start to plan together. If we run alone, we found out that we are not going to meet the ultimate end of changing the lives of our people. No matter what kind of physical investments that we do, unless and otherwise it's going to be utilized, it's not going to take us to the next phase where we want to take our people to. So that was the major cause that made us to come together and start to plan together. Keeping this in mind, transport planning and provision of infrastructure in Ethiopia in cities has still been largely car-centered and underestimating the importance of non-motorized transport. But recently, the capital city, Addis Ababa, the city government decided to construct about 200 kilometers of bike lanes and 300 kilometers of pedestrian in the coming 3 years. We're saying that this is a good start, but this is not what is being exercised in all cities that we have. This is the action that is being taken by the pioneer, and it is something that needs to be replicated in every kind of cities that we have in our country. So most of urban plans of regional urban centers that we have in cities have local development plans of their own in theory, and its intent is to make sure that it's going to be proportionally allocated to different kinds of land use for roads, for housing, and different buildings and open spaces. But in practice, even if they have a local development plan, in practice, they incline for prioritizing for construction purpose, construction of buildings and others. So the issue of transport, even if it's theoretically expected to be inculcated in the local development plans, it is not being practiced. And that is something that we want to change. That is why we need to have an unmotorized transport strategy, which is going to make sure that all the concerned authorities are going to consider while they plan and while they execute their plans to benefit their people. And even the educational curriculum that we have in our universities, for instance, in civil engineering, the transport planning program in the country has historically has emphasized the highway design and construction, has placed less emphasis for non-motorized transport. So we're not going to blame our engineers because that is how they have been taught while they were at school. Even we're trying to revise the curriculums by working with the Ministry of Higher Education. That is something that we started. And we believe that we need to keep on doing such kinds of actions to change the problem from the root cause. And we are also monitoring whether our accountable institutions like that of Ethiopian Roads Authority, which is responsible for the construction of all trunk roads in the country, has included the issue of road safety and non-motorized transport schemes in their own road development design and planning process. And also the Federal Transport Authority has now fully mandated to introduce and expand the concept of an application of non-motorized transport systems across Ethiopia in different parts of our towns. Even recently, we are preparing our 10 years perspective plan. And the plan has been prepared in conjunction with the Ministry of Urban Development and Construction, which is the one responsible for the design of urban centers. And as urban development and construction works needs the holistic view, and we are closely working with the ministry to inform and enforce the enactment of biking and cycling ways in the city or towns development endeavors, especially in connection with the urban greenery industry and other institutions and different stakeholders for the environment. We are encouraging government stakeholders, regions, and city councils to organize city streets not just as space for movement, rather as the one which is going to assure the health Actually, I'm done with my points. Thank you.
Okay, sorry. I may have lost the connection. I'm not sure if it was on my end or your end, but thank you so much. And I'm afraid we have to wrap now. But Madam Minister, that was really so inspiring to hear. I'm sure many will be watching the progress in Addis as you roll these plans out. And it's really tremendous to hear that you're doing it from the top to the bottom, from your educational system all the way up to all the integration of the ministers. And Professor Majid, thank you so much for your insightful thoughts on it's not just about bringing people to services with transportation, but really about bringing those services to people in their local communities. So a lot for us to think about. And for Dr. Maria Nera, the idea she left us with is healthy urban planning, more healthy urban planning. Thank you all so much for being part of this panel. Sorry for a little bit of technical glitch at the end. Thank you so much.